Hello, my name is Kenneth Gordon, a dermatologist at Northwestern University, and I'm going to talk today about the impact of psoriasis on work productivity and employment, and how one paper that was published recently in JAMA Dermatology suggests that treatment with ixekizumab actually might be able to improve these factors for the overall economic health of our patients. We often talk about comorbid disease with psoriasis, and we sometimes leave out economic health as part of that. But studies have shown that psoriasis patients have less employment, are more frequently unemployed, have lower incomes than patients without psoriasis. Moreover, that tends to be based on the severity of disease. So patients with more severe disease have poorer economic outcomes when taken as a population. This is incredibly important in our patients' lives, and we need to find ways to be able to improve that. There have been a number of studies that have just started to scratch the surface of looking at the impact of therapy for psoriasis on work productivity. Studies with adalimumab and ixekizumab have shown that there is an improvement in work productivity with therapy. However, what we haven't seen before is looking at trials with medications that have extremely high response rates, including PASI 90 rates and PASI 100 rates that are higher than what we've seen before, and whether that has an impact on work productivity. In this paper, published by Armstrong et al., all three phase 3 trials of ixekizumab were investigated in the context of work productivity. Work productivity was measured by the Work Productivity Activity Impairment Index, the WPAI. In these trials, what we were able to see is that work productivity improved both in comparison to placebo, but even in comparison to etanercept, not only in short term, but in long-term evaluation. So in the short term, in 12 weeks, we were able to show improvement in both presenteeism, which means that the patient is at work but not working as well, and absenteeism, that is the patient not being at work at all, and an overall work productivity. But what's even more important and impressive is that these improvements in work productivity maintained over time. Up to 60 weeks, these patients were able to maintain improvement in their WPAI, which is very significant in their overall ability to have functional employment. What was very interesting in one of the trials where the patients actually had to be re-randomized and go into placebo versus continued therapy with ixekizumab, it was evident that when patients had recurrence of their disease, when they went on placebo after they had response, their work productivity dipped again. Therefore, strongly suggesting that patients with psoriasis should maintain their response over time and not be allowed to flare in order to have the highest level of work function. Years ago, on a personal note, I was giving a talk to employers concerning psoriasis therapy and whether they should have insurance plans that pay for that. And we talked about work productivity and how therapy is very important. Their response was, well, maybe we shouldn't employ psoriasis patients, which is not the outcome I was looking for. Thus, it's really, really important for us to be able to demonstrate and to show for both the patients and for their employers and for the people who are maintaining health insurance plans that improvement in work productivity at a high level, like we've shown in this paper with ixekizumab, is central to the overall economic health of our patients.